Welcome to Office Hours. Whether you're new to the acupuncture profession or have been at it for decades, this is the place where we discuss all things Chinese medicine and more. Join Toby Daly, a seasoned acupuncturist of the Som tradition, and Angelique Britt, a nurse turned acupuncturist who is brand new to the field, as they explore topics in and around the world of acupuncture and Chinese medicine. There's something for everyone here. Drop in anytime.
Hi, Toby. It's good to see you again.
Hey, nice to see you, Angelique. How you doing?
Doing quite well. Thank you.
Great.
Good. Can we start out with some questions from a listener?
Great.
Okay. So this person says they recalled learning from you that you should avoid a kidney supplementation in cases with pain, as we don't want to consolidate the pain deeper into the body. Although this makes sense, is this always true, and might there be exceptions? And they list some examples, such as significantly severe SI channel or L2 pain in asymmetric patients, or for those who may also be lacking in self-love without any varicosities. So is it true that we should always avoid kidney supplementations in cases of severe pain? And what's the best way to navigate that if it looks like we have an SI excess person that
Yeah.
has pain?
Yeah, this is a great question. Um, yeah, just first of all, like kind of like a meta answer for that. For the Psalm system, nothing's ever certain, right? So I can't give any ironclad anything because there's always again the variability of the what's going on with the patient and then trying to apply that system to it. But in general, I would say for patients with pain, you try not to consolidate. I would say that in general, but hundreds of times I've supplemented kidney to help people
Hmm.
with pain. So in general, right? If all things equal and you have pain along the kidney channel or the small intestine channel, the likelihood is you're probably going to go to supplement small intestine to deal with the pain on both of those channels. But like this person's saying, let's say this patient is 95 years old, like they said, asymmetrical. What was the other
It
part of it?
was asymmetrical patients, or for those who may also be lacking in self-love and they don't have any varicosities. What about them?
Yeah. So, I mean, again, that's a strong consideration for supplementing kidney.
Hmm.
Especially a case like this. Let's say I have that situation where I probably am going to need to supplement kidney to deal with pain. If there's some other channel, I like to start off with that and then maybe not have to come up and make that decision. If there's something else really close nearby or another really compelling channel that needs to be supplemented, in general, I try anything that's a little bit difficult for me to decide, I try and put off to later. A
Hmm.
lot of times later never comes because your really clear channels, the ones that are really there's no reason not to do them. A lot of times if we take those and then the other channels, we don't have to go back and deal. So I like to procrastinate on anything that's not clear and then
Hmm.
come back around later and deal with it. And then a huge proportion of the times, I don't even have to do that. I don't have to come back and deal with anything. So um, yeah. So in the like to say with less words than I just did, in general, try and for pain, try your preference is to supplement small intestine to get dynamic movement for pain and
Hmm.
not consolidate. But sometimes you're backed into a corner and you're going to need to consolidate. You're going to need to supplement kidney, and that still will relieve pain. But
Hmm.
it's much less likely.
It's interesting because I had that patient that I talked about at our last episode that had the small intestine channel pain in the elbow. And I supplemented small intestine. It was like the elbow and shoulder, and it got worse. And I had to supplement kidney to relieve it. So I guess it's like it depends, right? That's always the answer
Yes.
in Chinese medicine and any sort of thing is it depends.
But it's so frustrating. But it's true, right?
Hmm.
Again, if it was philosophy we were just talking about, we could just make maxims and things like that, but we can't, right? Clinics, so we have to be
Yeah,
hyper flexible. Uh,
totally.
I forgot about that case. Anything that would have indicated for you to supplement kidney for that case, where we accidentally supplement small intestine when you shouldn't have? Was there signs? I forgot.
Yeah, she was kind of even. If I were to have employed the strategy that you had suggested, I probably shouldn't have done either because they were so close. So she had mix. So the face
Yeah.
was not super asymmetrical, but not super symmetrical. She had no varicosities. She had smooth medial heels, and she had pain that was on. She had some large intestine channel pain, but mainly small intestine channel pain that was worse at her elbow, like SI8 and then was up at like the SI 14, 15 areas where the majority of the pain was. One could have made a case that there was some gallbladder channel pain as well. So, Yeah, and she also like there are others when I reflect backwards, like she's a very hard excess person too. So there are other channels that I could have chosen. And ultimately the kidney channel was helpful to her. And I treated her again, and I can't remember what I treated her with this time, honestly. But for the same problem, did I choose? I can't remember. I have to look back at her chart. But yes, those are little outliers. They're kind of even in terms of a case for kidney or small intestine. So it's a good
Yeah.
strategy that you suggest is if it's too close. Where I get messed up personally when it's close like that is when there's the damp and dry mix that's really close.
Yes.
And so what to do in that situation? Because I really love the damp dry discrepancies. That's like I'm like, yes, like if it's a clear dry on the inside, we're like awesome, because then you have two choices automatically. You're like, this is great. But when you have somebody, for example, like I have a patient that I've been treating with SOM for a while, and this person has a very dry mouth, very drippy nose,
Hmm.
and their bowels vary. So they're sort of an even damp dry. Or is the nose on the outside? Is the mouth on the outside? Is it on the inside? And at what point, Exactly. But there's so many even things that I would love. It's hard for me to choose.
But try to go to something else. If not, then you just have to choose.
Then you just have to. And I
Yeah.
have, and not without detriment. It's usually been positive. All right, there's another question. This is a rumor. This person had heard from a group. We're not going to name the group, although the group has been named, but that one should never supplement kidney at a first visit.
Yeah, but again, that comes back to our rule.
Mm-hmm.
It's possible I might have said that at some point, but that I said that erroneously, right? I don't think we should say ever 100% certain we should do anything.
Okay.
But in general, I think it's not to supplement. It's not wise to supplement kidney on the first visit. Do you have a sense why? And then otherwise, I'll tell you why I don't recommend that.
I could, since it's a consolidating treatment, if someone comes in with an issue, would it be sort of like pushing it deeper into the body?
Potentially, right?
Okay.
And especially when I first meet a patient, I don't feel like I have a good beat on them, so I don't
Mm-hmm.
want to start locking things in until I know them well. So, uh, yeah, again, like we were saying before about supplementing kidney for pain, many times I've done that, but many times I must have started with, I can't think of anything recently, but starting with supplement kidney. But in
Mm-hmm.
general, I try not to do that.
Yeah,
Also, I'm really hesitant to supplement gallbladder too, even long-standing patients. I just feel like that's such a squirrely channel. So
it is.
but I'll do that, right? I did recently start with a brand new patient by supplementing gallbladder, so I will do that. But in general, I try not. I would try not to supplement kidney right away and gallbladder until I get a real feel for the patient, unless their case demands it, right?
Mm-hmm. So what was it about that case that demanded a gallbladder supplementation?
Patient was really sick. Um, This is a status post vaccine reaction. Again, I spend a lot of time really trying to deny this, but
Mm-hmm.
this seems to be the proximate cause for this. Had vaccine and then developed ALS.
Oh,
And there is some in the literature is pointing to that as a possible link too. So, anyways, we need to get started right away. This patient's from
sure.
far out of town and was presenting extreme pericardium excess, and so I started out right out the gate with by supplementing gallbladder.
What were some of the pericardium excess signs that you were seeing?
That really heavy feeling, everything was really going inward for the patient. Um, they're they present intellectual and so physically down and heavy, careful steps, and then just really intellectualizing everything. So we really need to get gallbladder up to spring that out.
Got it. So you perceive so heaviness I had thought was more of a dampness, like spleen excess quality.
This heavy, careful steps, like you see with
Oh,
ALS or
in the gate.
Parkinson's. Also, I see that. Yes,
Mm-hmm.
that is a pericardium excess. Gallbladder is like light and ready to fight.
Sure. So in the heaviness category, if someone feels heavy, that's more spleen, or if someone is moving as if they are heavy, is that more pericardium? Is that where there's a distinction?
Yes, I mean usually damp has some physical component, and
Mm-hmm.
and pericardium could like this patient was really lean, but
Mm-hmm.
just really careful steps, careful heavy steps.
Okay.
That's more pericardium, especially with being lean. And then also we could see that with like spleen excess, they might also take, less, the body's so heavy, they'll take less steps, be a little bit more lazy about, activity and things like that. But then we'll see the physical component, the actual dampness in the body.
Got it. Thank you. That's helpful.
Yeah.
Speaking of pericardium, I had two different folks report that when they supplemented pericardium, either on themselves or a patient, there was a sensation of bubbles.
Great. Okay, good.
Isn't that interesting?
Yes.
You had told me that happens sometimes, so it was interesting to hear that unsolicited from people. And I have had that actually personally happen to myself when I've supplemented pericardium, where I felt like there's a weird, like a tingling. It didn't feel like bubbles necessarily, but it was like a tingling. Maybe it could have been
Yes.
bubbles, like an effervescence, I guess.
It really does feel like bubbles,
Yeah.
from my experience, right? And yeah, again, unsolicited, that's really valuable, right? Because we have this theoretical idea that this pericardium's oxygenating everything, and then when the patients can actually feel those bubbles inside them, right? I think it's interesting, right?
Mm-hmm.
What about are you doing much self-treatment?
More,
Hmm.
not with as
How,
much regularity as I want to. My goal is to do it at least once a week, but I've been doing it more. And I find that I tend to have similar excesses on a continual basis. And so I'm always wondering, like, should I still, like, for example, I have to supplement my pericardium kind of a lot, or my liver or my large intestine. Like, those are like my top three that I have that I tend to rotate through on a more regular basis. Is that a common and okay thing?
Patients I see on long term, I tend to find three excesses or three deficiencies I need to supplement. There tends to be about three. Usually for the intro class, I have students come up with three channels to come up with for each patient because it seems like that seems to be about right. Again, there's no fixed rule on that, right? Sometimes
Sure.
it's one or two, and sometimes it's eight. But it seems like almost everyone has three things, three constitutional things that you could just work on for your lifetime. So that's probably right. Jeffrey Wen had a nice recommendation for this for self-treatment. If possible, treat yourself. If you get into any trouble and can't figure it out, then go to other people. But I think that's a good 1, 2 step framework, right?
Mm-hmm.
Um, you'll learn tons by treating yourself, but you're not
Mm-hmm.
going to have a very clear perspective on it. It's so much easier when a patient we've never met before comes in and presents in front of us. We're just got pure diagnostic window on them, and we
Mm-hmm.
can just use all of our perceptions, all of our training on that. Whereas we go to turn that back on ourselves, it's always going to be a little bit distorted. But you
Sure.
should try, and then especially if you're successful, it's great. Then you'll learn a lot. Even if you're unsuccessful treating yourself, you'll learn a lot too,
Yeah, that's true.
clinically and about yourself.
Yes. Yes, I can concur. So it's okay to do that. So because I've seen that there's been some patients that I've seen fairly long term. I mean, as long term as I have been treating with SOM, right? So 6, 7, 8 months in my own clinic now, and there I see patterns because I have a little system in my medical record where you can make a note and I star it so it kind of comes up all the time, and I just will list the channel treatments that I've done over time. So I've got like an at a glance, and I see like a rolling sort of pattern with some people where it's just like, a couple different channels, small intestine, a couple different channels, small intestine, like stomach and lung. I find that those come up quite a bit. And sometimes one week I'll treat a stomach and then the other one I'll supplement lung.
That's
Like,
for the same patient.
yeah,
That,
that's
that's
happened a couple
unusual.
of times.
That's unusual, but sure, that can happen.
So I wondered if I did something, if I could have chosen a different channel. Like I'm wondering if I tipped the balance in one direction, then required supplementation with its counterbalanced part.
It's
That's what I was
possible.
wondering.
But I mean, always watch, especially for that first time you supplement lung, make sure something good happens.
Hmm.
Sometimes it happens like that, where you just in order to get something good going, you have to supplement lung and then come back and supplement stomach.
Hmm.
But that's unusual.
I was treating a pregnant patient with some, and I got permission from their midwife to help because they're not quite at term, but they might have an induction ahead of time and to support the natural onset of labor with acupuncture. And this patient I was treating with TCM acupuncture up until, I don't know, maybe 5 weeks ago. And I was like, there didn't seem to be much movement in her way of feeling like she felt better, but it was sort of not quantifiable. And I started treating her with Som, and just the way she was existing is different. Like the way she walks into the clinic is different. The way that she talks about her week is it's just there's just like it's an uplet. There's like an uptick in her way of being. And I did supplement lung on her last week, and she talked about how much energy she had. And I was like, is that real? Does that really happen? It was wild. So yeah, it's very cool when you can get it right. Yeah.
Yeah, I feel like that's one of the more rewarding things we do to help induce just natural labor. I think is really rewarding work.
Yeah,
And
I might get to do it.
yeah, but Psalm seems to be pretty effective in that.
And you just find the imbalance in the moment. Yeah.
Yes, again, this is from Dr. Wu, how I try and apply that, right? Remember, babies like upward, warm, and blood. So
Hmm.
especially then I consider downward, cool, or dynamic movement to get things
So like
going.
bladder or small intestine.
Yeah.
Okay.
Or stomach or large intestine, depending on how it's presenting.
Okay.
But it's rewarding, right, when they come to your clinic and then go directly to the hospital to deliver.
I don't know. I'll tell you if it
Okay, no, but
happens.
I'm saying
That
that
would be
happened to me.
amazing.
That's really rewarding.
Yeah, I can imagine. Yeah, if that's gonna work out, it'd be great.
Especially, I have a lot of patients that really don't want C-section, right?
Hmm.
For like their intellectual understanding of what's going on, or just just don't want intervention, but that
Yeah.
kind of hard, more natural things.
Hmm.
And so it's really nice to be able to do that.
Yeah.
Usually the body's just like a little hitched up. I mean, it's designed to do this, right? So
Sure.
that's why just a couple needles sometimes can be so powerful.
Yeah. I did the safe thing and covered myself and got permission from the midwives
Okay,
because
that's it.
they're
That,
not
that,
full term quite yet. That's how I was basically given the general okay, like basically what they told me was that like basically anything after 38 weeks they're cool with acupuncture as being an intervention for supporting the natural labor process.
Great.
Yeah.
I like having a little bit more time like you have too. That's nice.
Hmm.
Usually it's like they're going to induce in 2 days when I see them. So I'm like, okay, we really got to get going. It's
Yeah.
nice to have a little more time to just kind of prep the body.
Yeah. So it's an interesting experience. So what is
What
on
else?
your agenda?
Uh, I was going to ask you another question if it's okay.
Sure.
You were saying before that you have a patient that does like numbing agent on
Yeah.
the points. What about, do you have any other, what do your patients do for like coping mechanism to do
In
with
their
some of these sound points?
they make sounds.
Yes.
They'll hold their breath and I'll try to tell them not to do that. But they'll have to remind them to breathe. Um, Yeah, those are the top two. Is there'll be some kind of like exclamation of like oh or something along those lines. Sometimes an expletive or two might escape, and then just like I'll feel they'll tighten or they'll hold their breath, and I have to. It's okay. It's relax. It's just a moment. It's a moment. Big sensation, big reward. That's like my go-to line these days.
That's great.
Yeah,
It's true. So it's nice to reassure patients with true things. So that's really nice to be able to say that.
yeah,
Uh, I read a study about that. Every culture has taboo words, and everyone says those taboo words help alleviate pain. And actually, it works. They did some
nice,
study with like shock therapy, where they would check, oh, yeah, when they give a shock, and then they allow people to swear, allow people not to swear, and actually the people that swore, they thought the shock was less than the people that just without. So it's for I'm not sure exactly the neurology on that, but by saying a taboo word really helps relieve the pain. So I always encourage patients to say it. I say I don't mind a little bit of sailor when I put these points in.
nice.
And yeah, I have patients also do all kinds of crazy things. Like I have a patient that really shakes her head. It seems to really help her. Again, body has a hard time paying full attention to two things at once. So by shaking her head, then that the points have less pain for them.
Interesting. I have a patient. I don't treat this person with SOM, and I actually use Sarens for this person. But when I needle them, they rub their face.
Yeah. I think it's okay, right? It's so important for us to get the points in.
Hmm.
So any coping mechanisms the patients come with, I think it's okay.
Yeah, well, that's good.
I
I'm
have
going
one
to
patient,
coach them to swear now. Thank you for
yes.
that.
I have one patient that has to yell, and so I actually have her yell into a rolled up towel, just so it doesn't disturb the other patients in the clinic. But she has to yell it's actually much better now, but it started off by like almost movie scream yell,
Yeah,
just so loud. So
yeah.
so anyways, into a towel now. That's my method for that right now.
How do you not startle? I find that I sometimes still will flinch when people scream if I'm not expecting it. Like to the point where it's like I'll go and I'll start the insertion, they'll scream, and I'll reflexively pull it back. And I'm like, shit, you know? Like, you
I,
okay? I'm okay. We're okay. Okay.
I think
Try
that's
that
just
again.
nat I think that's natural.
Okay.
I think I've endured that so many times. I just continue through.
You
And
just
then
do it.
I think now my instinct is to finish that whatever technique I'm doing there to so we can stop that rather than
Hmm.
trying to pull back, right? I go forward to make sure that that's we get the most out of that scream.
Yeah. I even as a nurse with injections, that's part of the reason I didn't like to do injections because if someone flinched or if they made a sound, I would reflect it was a reflex. I
Yeah.
would reflexively draw it back. So yeah, I've got
I
to
think
work
it's
on that a little
I
more.
think it's natural. And then also it's nice to know who's going to be doing the more loud noises. You know, it's always our male patients, right? So it's nice to know that in general, the male patients are gonna there's gonna be some
Maybe some
noise or
emoting.
some emoting for
Hmm.
sure. Female patients so stoic, right? That usually it's just nothing.
Yeah, there are those, yes, those patients I worry about sometimes. But I'm also grateful for my own
Yeah.
nervous system because it's like you're not going to make any sounds. This is great, so I can do what I need to do and not have to worry
Yeah.
about the armor I have to put on myself to treat you. Yeah.
A lot of female patients they talk about how, you know, they had 3 or 4 kids, so they're just like there's nothing. So I think everything's relative in this world.
Yeah.
Sometimes men I don't know, just haven't had, you know, voluntary, you know, you're there. It's you're gonna have pain. You're volunteering to have that pain. I think something psychological about that men just have a hard time with.
Hmm.
Even though I mean empirically, right? It's not that painful considering like all the realm of pain you could have in your body.
No, but but bladder 66 hurts.
Yeah.
That hurts. I don't like doing that one on myself. And I feel like I've got a pretty solid capacity for pain. And that one, it's like, oh, I know what's happening. I'm just like, okay. I have to like grit my teeth to do it, and I do it. But I will say that your tip, which is really helpful, was to angle it toward the bone. So I
Yeah.
have a person that frequently requires this in their channel pairing and was able to give me feedback. She's like, wow, it didn't hurt as much. I was like, great, because I angled it. And I kind of like pecked the bone, actually, just like, doop, like got it right in that area. And it was fine. That the right thing to do, like kind of like peck the bone a little bit.
I try not to hit the bone, but I come really close.
Okay, I definitely hit the bone. So
Yeah. I mean, again, you've got a lifetime of refinement ahead of you.
yeah.
So I think in general for Chinese medicine, the advice is not to hit bone. So, but there's not much space there. So I get really close, but I do try not to hit the bone.
Yeah, there's not a lot of flesh there. I'll do my
Yeah.
best to not hit the bone
But
going
I think
forward. But
that's why it's so painful, right? There's just not much room there.
yeah. And like even the liver one's not even that bad. I've got one person who really hates liver one. They love it, but they also hate it because they feel the relief from the needle there, but they also just hate the sensation of it being needled and will often swear when that one goes in, which is, I guess, appropriate, right? For needling the jing well of the liver channel, swearing. Makes sense. Yeah.
I think we talked about that too. Also, and then that from Jeffrey when to really pump the
Yeah,
GMLs, right?
I do. And I put my fingernail in them to try to prep them. Like I'll rub them and then I'll put my fingernail in them and then I'll put the needle in. And, I think it's still just going to hurt. Like some of them are just going to hurt.
Yeah.
And I get the
So
feedback often, like, I can feel it throbbing. Like, yep, you're going to feel it. That's okay. That's
But the
okay.
nice thing is, especially since you're treating yourself, right?
Mm-hmm.
This I often tell patients about that too, right?
Mm-hmm.
Oh, is you have a real sting and a real throb for right now. In the next few minutes, that will start to fade. You know, you can just really talk them through.
Yes.
I say these exact words, right? I'm my own patient. I'm not always on
Mm-hmm.
the handle side of the needle, right?
Yep.
I'm my own patient, so I know exactly what that feels like. That's real comforting. And
Yes.
surgeons don't get to say that to their patients, right? I know
That's true.
exactly what it is to take out my own appendix, right? So it's really nice since we're treating ourselves and we can share our experience with the patient. It really bonds you, and then yeah, it's not just intellectual what you think they're going through. You felt that
Get it.
yourself many, many times. So
Mm-hmm.
it's nice to be able to say that to the patients.
And I do. I always tell them, like, I'm in solidarity with you. I've done bladder 66 on myself. I understand. We're going to take a nice deep breath. I'm going to do it. Are you ready?
Nice, right?
Yeah. Yeah.
Again, it's much more of a team thing that way then too, right? And
Yes.
yeah, your empathy is high because you know exactly what it's going to feel like.
Exactly. Yep.
Sometimes I joke with the patients too. I say, "This hurts me a lot more than it hurts you." So then they laugh and I put the needle in real quick. So
That's a good line.
sometimes it's nice to distract them too.
I try to get them talking because when they're talking, it seems to go better. But now that I've treated some folks a few different times, they get wise to what I'm doing. And so it's like as they feel me start to touch the point, they stop talking. And I'm like, no, 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 keep talking. They're like, no, I'm gonna wait. They'll just totally clam up. Like mid-sentence, will just like cut themselves off because they're waiting, they're bracing for that point to go in.
Yeah, they get wise to you. But I feel like too, patients I have to see long standing too, they tend to get less needle sensitive as things go on too. So that's sort of nice too.
Hmm.
They know it's coming, but then they kind of, again, everything's relative. So they've had needles so many times, so then it's just another set of needles they're getting. So it's
Yes.
less traumatic for them too. So that's nice.
Yeah, I've seen that
Do you,
happen.
do you tell patients jokes?
Not routinely. I usually, my
Okay.
demeanor is usually just playful. I usually catch
Yeah.
something they say, but no, I'm not like a why did the chicken cross the road type person.
Uh, a hippie got married.
Uh-huh.
What did they call her after she got married?
After the hippie got married.
Mhm.
I don't know, Toby, what they call her.
Mississippi. And
Okay.
that's from my friend from Mississippi. So I thought
Yeah.
that was pretty good. But so sometimes patients so tense, you just have to say, what do they call the hippie after she got married? And then they're thinking about that. Then you put imaging well, and then you tell them that, and then it really releases things. So try and put it. Not every patient, right? A lot of patients, so they don't need joke. That they have so many things going on, but some of them just so overly tense over nothing. It's nice to just kind of joke with them a little bit.
Yeah.
Especially if that's age appropriate everyone joke. That's what I like to remember that, right? And you could tell anyone
Yes.
that joke.
Okay, I've got one then. So you probably have heard this one before, but what do you call a cow with no legs?
I don't know.
Ground beef.
Okay, so that's good, right?
Right? What do you call a cow with no legs on a grill?
I don't know.
Patty.
That's good too,
So there
right?
you go. Yeah.
So
Like
again,
of the dad joke ilk.
yeah, the dad joke ilk is nice because
Yeah.
it's sort of a tense situation. They're about to get a needle, so you don't want to
Hmm.
too complicated, too intellectual joke. You want just a little silly joke.
Yeah. What my teenagers would call cringe. Mom, you're so cringe.
Yeah, you have to tell cringe jokes when the patient's
Hmm.
cringing from the needle.
That's
That's
right.
you got to match the situation.
There we go. Match the energy. I like it.
Yes.
Yeah.
All right. Can I ask you another question?
Sure.
What about, I was wondering now, how long practice now? Like a year plus in practice?
Of Sam?
No, just in general
Oh, in
practice since you
general?
got your license.
Oh, no. I got my license in October of last year. I'm coming up on my anniversary.
Okay. So almost a year.
Almost a year.
Okay. What about anything, if you reflect back on it, right, that you learned in school that now in clinic you're like, oh, that's what they were talking about.
Oh, off the top of my head. Let's see.
Yeah, I don't prep you beforehand. Sorry.
I got to give that one a thought. If nothing's coming to the fore. Do you have that
Okay.
experience?
Well, I want to tell you mine. I had to give a lecture one time about like what have I learned from the SOM system,
Hmm.
and one thing I really learned with, after so much clinical experience, right, is that the six conformation, the five phases, yin yang, that's not intellectual concepts. That's not on a list kind of things. Those qualities are actually in the body, right? And so, again, I intellectualized that, memorized that, and thought about that. But now I accept that those qualities are in the body. The points
Hmm.
inhabit them. The channels inhabit those qualities, right? So it was real dry intellectual at school, but now I feel like, oh, those are actually in the body.
You can see them.
Yeah, the qualities that the words that those are associated with, I see that manifest in the clinic, and then I can see them change. So again, it was just dry intellectual in school for me, and then in now in clinical practice, it's not dry intellectual anymore. I think I believe those are really in the body, and I believe that because I've elicited responses to those so
Hmm.
many times now. I feel like yes, those qualities leap forward when you use the 4-point combination. So things like that, right, where you just memorized it for a test, but then
Hmm.
actually you see it now.
I feel like I'm still very much, I'm looking forward to the time when my brain is not in survival
Mm.
with starting the business and trying to figure out the raw herb pharmacy and seeing patients and dealing with insurance and doing all of the things. Like I'm having clinical experience. That's really good and helpful. But I'm wondering, I'm actually surprised that I'm not able to come up with something more quickly. And I'm wondering
Mm.
if I'm focusing on so many things right now that it's hard to really catch. I think I'm missing probably some really key details in the effort to hold all of the things that I'm holding, if I'm being perfectly honest.
Yeah.
There's a lot going on.
Yeah, it
Yeah.
is. This is the worst time to practice. It will just get better and better from here.
Yeah, that's what I keep holding on to.
Okay, but anyways, that's my experience. And then colleagues I've spoken to, they talk about how sweet it is now because there's no substitute for clinical experience like what sailors call time in the boat. There's no substitute for that.
Yeah.
You're really fortunate, at least you had from your Western side, you have a whole bunch of that clinical experience, right? So I think that's really gonna help you now. But you have to just get your time in the Chinese medicine boat in. But
Yeah.
after a while, right? I mean, it just it gets sweeter and sweeter, and you just get more and more helpful. Everything's a little bit less stressful. But you can't start there, right? You have to start at the beginning, and
Yeah.
then this is the worst time to be practicing. So you should take a lot of comfort that you're doing so well at the worst time to be practicing.
Thank you. I appreciate you saying that. It's
Mm.
it's one of those I have those moments, riding the peaks and valleys of things and just being like, man, what did I do? There's some days where I'm just like, what did I do? And other days I'm like super happy I did it. And then other days it's like, oh man, I want to jump out of the damn boat. Like maybe I shouldn't have gotten in the boat to begin with here. What am I
That,
doing in
that
my 40s starting over?
that ratio will get better and better.
Yeah, that's good. Thank you. So for
Yeah.
all of you out there that are new doing this, especially starting your own, goodness, it's not for the faint of heart. I
Yes.
remember you telling me, in the beginning when you start your own clinic, that it's harder up front but easier at the back end. And then if you're working for someone else, it's easier up front, but can be a little more challenging down the road.
Usually much more challenging because you never get to pick the artwork. You never get to pick the hours. It's great in the beginning because you have a job and you have
Hmm.
patients and things like that. I mean, it's just so great, easy. But then as you go on, you're like, oh, I'd really like to do moxa, but we don't do moxa here. It'd be great to have a raw herb formula, but we, can't- all those you just get more and more hemmed in. Where
Hmm.
starting your own thing is so difficult because you have to make all the decisions. Am I going to do raw herbs? Am I not going to do raw herbs? How am I going to do it? I mean, it's so difficult to get started. But then you just have nothing but freedom. And then also, as you get more and more experience, it's nice that you make those decisions better. Now you
Yeah.
have to just kind of guess what you might need, what you might want to do, how
Yeah.
it's
It's
it's,
you're
it's
trying stuff on.
yes, but
Hmm.
it's so nice once you have your outfit, right? Then you just put
Yeah.
that on and just keep doing that over and over again, right? Especially you'll try some outfits that just do not work, but then
Yeah.
you just discard them and never pick them up again. And then where the outfits that work so well, right? You just keep putting on over and over again.
Totally. One of those with the herbs in particular. So I have raw herbs. And so I started to grind them individually and was like, I hate this. I don't want to do this. Like ever have because I thought, oh, it'll be easier because I'm by myself. So I have to figure out a workflow that's going to be okay for me, like, visit intervals and time to prep herbs because I have more people now that are wanting herbs. And so coming up with formulas for herbs, and that's, exciting and scary in its own right,
Mm.
being new with this as well. And I was dreading and I was dragging my feet. I think I talked about this on here, like to do this because I was like, I really don't want to grind every single. I got through 5 herbs. I ground 5 of them, like little individual amounts, and I was like, I'm not doing this. So I'm
Right.
just doing them in formula. So I weigh all the raw herbs together and then I grind the formula together. And then that makes more sense. And of course it seems like obvious to why wouldn't you do that? The grinder's really loud. So that's
Yes.
the only downside. So when I haven't had to do this yet. I've been able to do it kind of in an after hours, but when folks are resting, it might be a problem because where I am, the walls are fairly thin and that thing is loud.
Yes.
So we're going to see how that goes. But I am not grinding individual herbs. I'm not doing it.
Yeah, but that's great. I think it's good to do that rather than just wear yourself out for something that's not going
Hmm.
to give you good feedback. I
Yeah.
forget if we talked about tinctures yet, making tinctures.
You talked about it.
That's really easy.
I know how to do it.
I know, but it's really easy and quiet
It is easy and quiet.
and,
What do you
and
think about
compliant and really compliant for patients too.
yes, I know when a Western, because I started my whole foray into this, to jump into the Chinese medicine boat was by way of going and learning about Western herbalism that segued into some Eastern and Native American herbalism. And so that's what I learned. It was tinctures. And yeah, I totally agree with you. Where I'm getting into sort of brain knots in my own head about tinctures is that there's some argument that the alcohol changes the energetics of the formula.
I think it does.
And so how you account for that.
Yeah, I mean, a lot of times it enhances it, but especially, I mean, we know so well for I think it's Shenong Bancao Jing, right, where we know alcohol is hot, right, and
Mm-hmm.
if not there early on in Chinese medicine, we recognize it's hot.
Mm-hmm.
So it's going to have a warming nature to the formula. I think if you boil off the alcohol, then it's going to have less of a warming nature. Otherwise, you can have them take room temperature water if you want to have a little bit more of a warming nature with it.
Okay. So
So
you
that
do you make and press out your own tinctures?
I don't press them. I just put them in and then pour them out 2 weeks later,
Ah,
at the soonest. And then mostly they're just sitting
okay.
because pressing is a pain in the neck and you don't get
Yeah.
that much out of it. So, I mean, it's just really easy. And it seems to be really effective. I did hear one story about a very successful acupuncturist. She was in Texas, I believe, and she was doing infertility. And so
Mm-hmm.
she had raw herbs, powders, and tinctures. And she
Mm-hmm.
did a little study, and she found that the patients that took the tinctures tend to get pregnant better than anyone taking even the raw formula, which she was really surprised, or the powders. So again,
Wow.
that's a small little study from her experience, but I think that's similar to me. I think that tinctures themselves have a little bit more potency than maybe not raw herbs, because again, I feel like if you can dial that in properly, that's the most potent one.
Mm-hmm.
But definitely compared to powders or capsules, I feel like the tincture does have a little bit more potency.
When you say powders, do you mean granules?
I do mean to say
Okay.
granules, yes.
Interesting. Okay. It gives me something to think about. I've made my own tinctures before. I know how to do it.
You know how
I always
quiet
thought
it
that I
is?
had to press them out to
No,
really get all
I
the
got
goodness out of there.
I got that press, and you barely get anything out of that press. It's such a pain in the neck. So.
But did you get the hydraulic one, like the hand crank one?
No, I got something that was like for potatoes. It's supposed to be for smashing potatoes, but
Oh,
it's some kind of hack for herbalists to do that. So I did
yeah.
it. You press a little bit more, but it's so much work. So
Yeah, it is. It's a lot.
yeah, and I mean the color's amazing. I mean the color, it's definitely pulling it out. I mean
Mm-hmm.
that's the cool thing about alcohol. It's a solvent and a antimicrobial too. So it's really
Mm-hmm.
nice. Pulls out all the things we want and then protects it. It's ideal.
Yeah.
Too, the Chinese character for medicine, right? The base of the character is alcohol, right? So I think we've been doing this for so long. I think it's just part of the medicine, right? Making tinctures.
Okay. Thanks for giving me some more food for thought.
Okay, yeah. Again, this
Yeah.
is one of my stumble upons, and now I just love it. Um, Again, I think it's a little bit more effective. It's easy, and then I can use a lot of locally grown Chinese herbs, which is nice.
Mm-hmm.
It's nice to be able to do that rather than granules, right? It's just in Taiwan. I'm not sure about the sourcing. It's nice. It's so nice to see the herbs like you're doing with the
Yeah,
grinding,
I like the herbs.
but this is quiet and easy.
Do you tincture whole formulas sometimes, or do you do
Always,
simples? Oh, so you tincture a
always.
whole formula.
Yeah,
Okay.
I have just one or two single herbs like ma huang. I have a single herb,
Mm-hmm.
maybe some other ones.
Okay. And then do you do them the standard, like your standard, like let's say, oh, Xiaoqing Long Tong, like would you just put all the herbs in out, maybe parse out the ma wang, but then put everything else in your little jar and then fill it?
No, no. Like if I make that, I make it like ma xing shi gan tang. I make it with ma hong already in it.
You do that. Okay.
Yeah, but I have just ma. I got scared during COVID. I got 5 pounds of ma hong, and so then I used almost no. I think I might have used no ma hong for all my COVID patients. Right? It wasn't part of the pattern when I saw the patients. So
Yeah,
so then I was like, oh man, my ma hong. So I just started tincturing
tincturing it.
it into anything I could think of. Ma hong tong, ma xing shi gan tang. Anything that had Mahuang, I just started making that formula and then did single Mahuang too. So again,
Mm-hmm.
that's mostly just sitting there. Again, that's so valuable, right? Because then you can activate and preserve it in
Mm-hmm.
tincture, good forever.
Yeah. Yep. That's true. I've got some ma huang I need to tincture as well. Because I mean, I have some, but like, am I going to use it? I don't know. I'm a little afraid.
No, but again, you may really need it, so it's nice to have it on hand like
Yeah.
that.
Yeah. Yeah. Very good. What other questions you have? I don't think I have any. There's no more
I,
from the readers or the listeners.
It's again, we really appreciate listeners. Thanks for listening to us, and thanks for getting in the conversation by sending your questions to Angelique. That's really
Yeah,
nice. So
really
thanks for
appreciate it.
doing that.
Always fun to get an email.
Yeah. I got a few more questions for you, but let's save it till next time. Okay.
Okay, that sounds good to me.
All right.
All right, take care, everybody.
Yeah. Take care.
Bye.